Good afternoon and good morning to our viewers on the West Coast, Alaska, and Hawaii. Welcome to our webinar, Meet the DSMES Promotion Playbook, changing the way we talk about DSMES services. My name is Alexis Williams, and I will be your moderator today. I'm the lead for the Health Education and Promotion team in the Division of Diabetes Translation at the Centers for Disease Control and Prevention. I would describe myself as a woman wearing red glasses and seated in front of a blue and white CDC background. I would now like to introduce the Director of the Division of Diabetes Translation, Dr. Christopher Holliday. Dr. Holliday?
Thank you, Alexis, for serving as our moderator, and good afternoon to everyone. As Alexis said, my name is Dr. Christopher Holliday. I am an African-American man with a brown complexion, with short black hair, black rimmed glasses, and a salt and pepper beard. I'm wearing a white dress shirt with a navy blue blazer and a little white pocket square, and I've got a bright blue background with the earth as in relief. And a CDC logo. And it is my pleasure to be with you today. We are very excited to share the results of 3 years of extremely hard work to help change the way we talk about diabetes self-management, education, and support services, or DSMES services. The new DSMES Promotion Playbook will help CDC and its partners promote DSMES services with one voice. Consistent messaging can help create an identity for DSMES so that people with diabetes are more aware of the services, reach out to learn more, and ask their healthcare provider for referral. As we'll hear today, the playbook was developed through an intentional collaborative effort of CDC and its national partners, along with insights from people with diabetes, diabetes care and education specialists, referring healthcare providers, state health departments, and accredited and recognized programs delivering DSMES services. To help us celebrate the release of the playbook and our longtime collaboration, we are delighted to have with us today special guests, Dr. Robert Gabbay, Chief Scientific and Medical Officer at the American Diabetes Association, and Matthew Hornberger, Chief Executive Officer of the Association of Diabetes Care and Education Specialists. Please welcome first remarks from Dr. Gabbay.
Thank you, Christopher, and welcome everyone. This is the culmination of a lot of work and very exciting. I would describe myself as an interesting exercise. I have a blue shirt and a multicolored tie, white hair, and black frame glasses on a red background that has the American Diabetes Association logo. And so let me just tell you briefly, the American Diabetes Association, fundamentally, we're about improving the lives of people living with diabetes. And how we do that is funding cutting edge research, empowering healthcare professionals of all kinds with the important information they need and guidance to be able to provide the best possible care, and advocating for people living with diabetes on a number of different fronts. At the community level, we're proud of having 3,500 education recognition program sites with over 5,000 diabetes care and education specialists. In order to be able to do the work that we do, it's critical that we have partnerships. And one of our really strongest partnerships and longstanding is with the Center for Disease Control, whether that's a project that we're doing together on bending the curve on the number of people developing diabetes through the Diabetes Prevention Program, or in this case, the work that we've done with them and others to develop DSMES resources, the playbook. It's critically important that that people have access to the kind of information they need and the guidance and support to live a healthier life. And so we're very excited to see this launch, culmination of a great deal of effort by a number of individuals.
Thank you, Dr. Gabbay. Really appreciate your words. And I'll now turn it over to Matt Hornberger, the CEO of ADCES. Matt, take it away.
Great, thanks, Dr. Holliday. As you mentioned, my name is Matt Hornberger. I'm the Chief Executive Officer here at the Association of Diabetes Care and Education Specialists. I describe myself today as a white male with glasses, just a little bit of gray hair. I happen to be sitting in front of a window on a nice but slightly chilly Chicago day. So thank you for the invitation. I'm so happy to be here. And also to tell you that ADCES is so proud to have been a contributing partner to the development of this DSMES Promotion Playbook. As most of you on the call know, ADCES is an accrediting body for diabetes programs that provide DSMES services. And our DAP program has nearly 800 programs and 2,100 sites. I know that many of those that work with those programs will appreciate the additional resources that will allow them to reach more people with diabetes in their communities. And that's so important. DSMES services, we believe, are a very underutilized benefit. And we believe this toolkit, which has been so thoroughly researched and tested, will go a long way in helping those accredited programs describe their DSMES services in a way that's really easy to understand. And that the result will be that more people with diabetes understand that they're diabetes care and education specialists and the services that they provide can help them lead a healthy life. And that's really most important and why we're all here today. We've already started making the materials available to our accredited programs and to our members, and we're committed to continuing that work. So understand that although this is a bit of a kickoff, we're committed to continuity and making sure that we continue to do that. Lastly, from all of us here at ADCES, on behalf of our staff and our members, so many thanks, Dr. Holliday, for your leadership and the work of your team and developing this really much needed playbook. Can't tell you how happy that we are to see this work come to fruition, and thank you for everything that you've done to support the delivery of DSMES and our members and what we do every day. Thank you.
Thank you so much, Matthew. And Dr. Gabay and Matthew, we greatly appreciate you taking the time to join us today and for your ongoing support and partnership. We couldn't do this work without you, without our valued partners. So thanks to everyone who contributed in no small way to the culmination of this important resource. And now I'll turn it back over to our moderator, Alexis Williams. Thank you all.
Thank you. So before we jump into the content for today's webinar, I will just go over some information. At this time, we're required to share our disclosure statement. CDC, our partners, content experts, or their spouses and partners wish to disclose they have no financial interest or other relationship with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. Planners have reviewed the content to ensure there's no bias. The content presented will not include any discussion of their unlabeled use of a product or products under investigational service. CDC did not accept commercial support for this CE activity. There's no fees charged for CE activities, and the findings and conclusions of this presentation are those of the authors and do not necessarily represent the views of the CDC. This program has been approved for continuing nursing education, continuing education credits for health educators, and continuing public health professional credit, as well as general CEs. To receive credit, please complete the course and take the post-course test available at www.train.org/cdctrain. A registration code for this activity is required, and the code is diabetes. This information will also be put into the chat for you. Please note that if you have never registered at CDC Train, you will have to create a new account, and returning users should log in with their existing username and password. This webinar is being recorded, and an email will be sent out once the recording is available. The recording will also be approved for continuing education credit, and the slides and the transcript of the webinar will be made available with the recording. During the webinar, if you have a question for our speakers, please type them in the Q&A box below. If you want to direct your question to a particular speaker, please feel free to note that in your question. We will do our best to answer all questions during the Q&A portion of this webinar. If you have a question about obtaining CE credits, where to access this webinar once it's over, or other technical questions, please use the chat box feature. Okay, so I would like to begin by asking you a question. To share your thoughts with us, go to menti.com and enter the code 174560007 or scan the QR code on the screen. You can do this from your computer or mobile device. If you use your computer, please be sure to open in a new window so you can keep the webinar session connected. We will put the link in the chat as well. This will be the same link throughout the webinar and will be shared throughout the presentation. So the question is, what has been your experience when talking to people with diabetes about DSMES services? Do you regularly talk about DSMES services? Do you regularly talk to people about these services and refer them? Do you occasionally talk about DSMES services? Have you never talked about DSMES services, or is this not applicable to you, or you're not sure? Please share your experiences with us. Okay, here it comes. Always refer, frequently. Few not often. Lots of I always talk about it. Always. Always, often. Great. Thank you for responding to our poll. For those of you who always talk about it, always refer, the tools that we present to you today are going to make your life easier to communicate about it to people living with diabetes, as well as the healthcare providers. For people who rarely or almost never refer, again, these tools are going to really make it easier for you to start to refer people to DSMES services. And we hope will really facilitate having those discussions with people about the benefits. All right, thank you. So without further ado, it is my pleasure to introduce today's presenters, who are also from CDC's Division of Diabetes Translation, Betsy Rodriguez and Keith Akins. We are so happy to have you both with us today. I'm going to turn over the presentation to Betsy. Thank you.
Thank you, Alexis. My name is Betsy Rodriguez. I'm a Senior Public Health Advisor in the Division of Diabetes Translation, and I describe myself as a Latina woman wearing a yellow top and a yellow hat with brown cat-type glasses and a blue CDC background. To start things off, I want to ask in your own words, how would you describe diabetes self-management education and support services to a neighbor? To share your thoughts with us, please go to menti.com and enter the code that you see on the screen, 1745007, or scan the QRC code or use the chat box to answer the question. Here we have, let's see. DSMES services are education services that include education on how to live well with diabetes. Good. A very helpful education and support program. Educating to help manage diabetes. Comprehensive diabetes education. There are services that can provide individuals with knowledge and skills to manage their diabetes, as well as to better understand the disease. Interesting comments here. What else do we have here? Our program is an ADA-recognized evidence-based program, patient-centered service that usually will cover by insurance. Curriculum cover topics related to diabetes self-management. What else? Comprehensive education to help people with diabetes improve the quality of life. Very important for all of us who live with diabetes. Quality of life is very important. Help with tips, tricks, and support for managing diabetes. Oh, yes, we need a lot of tips and tricks to live with a chronic condition like diabetes. I will agree with that one. We will work with you and your family to make managing diabetes doable. Love it. So the comments keep popping up, which I love all of these comments. Education to help manage diabetes and live well. Help people with diabetes live better lives. So, you know, quality of life and better life is something that is kind of in all of the comments that we're getting here. Look at that one. Diabetes is a lifelong journey, and diabetes education help you give the tools to better manage your diabetes and people to help you in your journey. I think that we can continue here in this route. So let's move on to our slide deck. Thank you. Thank you for sharing all of those thoughts. So diabetes self-management education and support, DSMES services provide an evidence-based foundation to empower people with diabetes to navigate self-management decisions and activities. DSMES is a cost-effective tool proven to help improve health behaviors and health outcomes for people with diabetes. However, despite considerable evidence that DSMES services are cost-effective and had a positive effect on diabetes-related outcomes, the use of these services is low. Low utilization rates are the result of many factors, some more difficult to influence them than others. But several factors could be influenced by changing the way we talk about DSMES services. CDC, Division of Diabetes Translation, in collaboration with national partner, set out to create a DSMES promotion playbook with clear and compelling materials and messages that will resonate with people with diabetes, referring healthcare providers, and everybody who are providing these services as well. As we move forward in the presentation, I want you to think about if your neighbor will understand and want to learn more about DSMES for themselves and their loved ones based on your description. We will come back to this later. The DSMES Promotion Playbook is designed to help accredited and recognized programs and others to promote DSMES services with one voice. This approach can definitely help more people with diabetes participate in the DSMES services and learn where to go for help, know how to take care better of themselves, and reduce how much treatment they need, including hospitalizations. Why is one voice approach for talking about DSMES services is so important? Let's talk about it. Think about your favorite places to eat, to shop, or to travel. How did you hear about them? What made you want to choose them? Consistent messages and images can inspire people and motivate them to act. Promotional materials can solve some challenges that affect enrolled in DSMES services, for example, cost, insurance coverage, physical access, or location. But improving recognition and promoting dialogue about DSMES services might help programs and partners advocate for change. The creation of the DSMES Promotion Playbook was a multi-phase development process that occurred over more than 3 years. Phase 1 began in 2018 with discovery research and testing to better understand audience experience, needs, and desired benefits. Using results from this research and input from partners, messages, concepts, and elements, including a plain language descriptions, were developed. The material and messages were then refined in phase 2 through iterative qualitative concept testing and confirmatory survey. Phase 3 began in 2021, where the DSMES Promotion Playbook was designed and piloted. Throughout this presentation, we will discuss each of the activities completed in the phases and what insights we learned. So to successfully develop materials and messages about DSMES services that will resonate with intended audiences, CDC will form a work group with representatives from American Diabetes Association, the Association of Diabetes Care Education Specialists, and other representatives from national organizations. It requires more than one to build a village. So the purpose of the work group was to help guide the DSMES Promotion Playbook development process, as well as to be leaders in the dissemination of the playbook. In addition to the work group, we continually engage with key audiences throughout the process. Individuals were recruited nationally from diverse locations, backgrounds, and level of experience with diabetes education. A lead review and environmental scan were conducted at the first step in this formative research process to help us gain an understanding of why people choose to use or not to use the DSMES services, as well as healthcare providers, referral practices, and belief about the DSMES services. We also did a survey across the three audiences group: people with diabetes, diabetes care education specialists, and referring healthcare providers. The goal was to identify attributes, ideal or not, of the DSMES services. The top 5 ideal attributes were effective, individualized, low cost, motivated, and practical. Throughout this discovery research, we learned that people who have received DSMES services found it valuable. People with diabetes want personalized support information that can help them better manage their diabetes. And messaging from DSMES services needs to convey that services are tailored for people with the diabetes to where they are in their journey. Using the results from the research we just reviewed and input from partners, concepts and elements such as plain language description, key messaging, and graphics were developed. To test these newly developed concepts and elements in an iterative series of focus groups, triad discussion groups, and individuals interviews were conducted. This process allowed for audience input at different stages of the development to refine the messages to promote the DSMES services. The examples findings that I can share with you were something like messages featuring you, meet where you are, personalized, matched participant belief that people need an experience, that people experiences are different. People with diabetes wanted to see realistic images of happy people. Both formal and more casual or friendly tones for the words were received well. Now let's go back to thinking about how we will describe DSMES services to a neighbor. One of the first tasks in developing DSMES Promotion Playbook was creating a plain language description for DSMES services based on insight from people with diabetes, diabetes care education specialists, and referring healthcare providers. And you see here the slide, the result of that plain language description of the services. Whether you are new to having diabetes or having it for years, when you receive DSMES services, you will work with a diabetes care education specialist to set and track your goals, learn how to use knowledge, skills, and tools to build confidence and emotional strength to manage diabetes. Practice how to fit diabetes care into part of life, like eating and problem solving. And then finding ways to get support in person and in online from family, friends, community, and the healthcare team. I definitely believe that one of the greatest contributions of all this long journey in doing this work is being able to having a plain language description of the services coming from the people who receive the services. In other words, people living with diabetes, as well as those who care for them and educate them. So participants were asked to rate how much they agree with statements on a 5-point scale and answer 2 open-ended questions after being shown various materials. This was used to evaluate the overall DSMES materials and messages appeal, people with diabetes interest in receiving DSMES services, and healthcare providers' interest in using the materials to promote DSMES services. All of the 3 audiences had a positive reaction to the DSMES description, the concept look and feel, and sample flyers. The majority of respondents found these items appealing, trustworthy, and of interest. The main concept of personalized support appeared to resonate across audiences. People with diabetes were interested in learning more, in talking more to doctors after seeing the developed flyer. Healthcare providers were interested in using the flyer or similar materials to promote the DSMES services. During the final phase of the playbook development, a pilot test was conducted to determine how the DSMES Promotion Playbook could be further improved to make it easier to use, more understandable, and more useful. 4 DSMES programs participated, and they represented a mix of organizations from a federal qualified health center, from pharmacies, local Department of Health, and community health centers that serve various populations. Overall, pilot testers had a positive reaction to the playbook. They felt like it was easy to use and feel an important need in providing outreach materials. Participants noted how the letter informing healthcare providers about the DSMES services was particularly helpful because all outreach materials to people with diabetes needed to be disseminated through the healthcare providers. To sending the providers the emails template was an easy way to inform them on the new materials, get the buy-in, and provide materials to them. So make it easy. That was the sounded message that we heard through all this process. So the messages and materials included in the DSMES Promotion Playbook are designed to, number 1, communicate in a common and compelling voice. Number 2, to resonate with people with diabetes, and to help strengthen partnership between referral healthcare providers and diabetes care and education specialists. Communicating clearly and consistently about DSMES services make it easier for organizations to amplify outreach efforts. The DSMES Promotion Playbooks includes a library of 150 ready-to-use high and low resolution photos of real people, templates for flyers, postcards, posters, and ads, messages that can be shared with people with diabetes and healthcare providers to support and change the way we talk about the DSMES services, like talking points, plain language descriptions, and email templates, and also an outreach letters and talking point for engaging referring providers. So here is an example of some of the materials, including a flyer, a poster, a digital ad. You will also find additional support like printing guides and FIQ. The playbook materials are currently in English, and a Spanish version is ready and will be published soon. Everything can be found on the DSMES Toolkit website under marketing promotion, as you see in the slide here. You can scan the QR code, and we will put the link to the playbook into the chat box. So now that we have been introduced to the materials, we have introduced the materials to you, We want to hear from you. Share your thoughts with us doing the menti.com and entering the code. It's the same code that we used before, or scanning the QRC code, or you are welcome to use the chat box. And the question is, what materials in the DSMES Promotion Playbook are you most excited to integrate into your marketing outreach efforts? Is it the plain language description? Is it the library of images? Is it the templates, flyer, poster, digital ads, and so forth? Are sample messages to communicate with people with diabetes, healthcare providers, and partners? Or is all of it? I see some of the comment popping up. The plain language, boom, they go so fast that I can barely see it. But the majority, if I can see, it's all of it. And then followed by templates, flyer, poster, digital ads, and posters. I see, I'm so excited to use all of them. I'm happy that you're excited. Well, I guess that the winner is all of it. And we are so thrilled to hear that actually you would like to use all of these resources that has been developed over a period of 3 years with intense work. There are so many ways you can partner with us using the DSMES Promotion Playbook. I want to turn the presentation now to my coworker, Keith, who will talk about these partnership opportunities. Keith, take it from here.
Thank you so much, Betsy. Hello and welcome again, everyone. My name is, in fact, Keith Akins. I will describe myself as a brown-skinned Black man with bald head, salt and pepper gray beard, with glasses, wearing a button-down shirt with a sport coat, and I'm sitting in front of a blue and white CDC background. So now that we know you're all very excited about using every single piece of content we shared about in the playbook, let's talk about some of those opportunities and ideas for incorporating those into content, into your existing and emerging efforts to engage people with diabetes in DSMES services. So the playbook was designed with specific groups in mind: accredited and recognized programs delivering DSMES services like those of the ADA and ADCES, but it's also for those who are working with those accredited and recognized programs, such as the ones listed on the slide here, like diabetes care and education specialists, healthcare providers, community-based organizations, and others. So it's one thing to create something like the playbook that has useful content, but it's an entirely different thing to make it relevant and resonate with the people and communities we're trying to support. So to that end, it was critical that we made the playbook customizable for you. Local programs can add their name and contact information on all the materials. You can see on the slide the little blue ovals indicating where that program information can be included. And the photos also can be changed to feature local program photos that you've taken, or others selected from the gallery of 150 photos that Betsy mentioned just a few minutes ago. The point is that the ability to use your local brand and name adds additional credibility and brings more attention to your efforts. And we recognize that programs have existing outreach and marketing efforts in place, and that incorporating new materials can sometimes be a little cumbersome, take a little bit more extra time than you have. So to help make using playbook materials practical and the least burdensome from the start, we asked DSMES providers for ideas for how programs can start using the playbook and its components in small ways. So here's some of the ideas that they shared with us. One, change the conversation. Start sharing the plain language description for DSMES services and make it more understandable. Work the description into your everyday conversations and written materials. Second, be a DSMES ambassador. Use your everyday communications to promote DSMES services. Add a message at the end of your emails to ask me about DSMES services, or add it as a hashtag in your social media posts. 3, make a splash at local meetings. Add the materials or images from a playbook to your virtual meeting backgrounds or transition slides in your slide decks at conferences. If you're hosting an in-person event, make tabletop signs or print the posters for display in the room. 4, expand your outreach. Add the posters, the flyers, and all those other materials to your existing toolkit of outreach materials. Download the templates, add in your local program information, and there you're ready to share. And don't forget that you can swap out the images for your local program photos. 5, cultivate clinical connections. If your organization uses electronic health records, use those communications and interactions to promote referrals to your DSMES services. Add the playbook materials and messages to the referral and patient messaging templates to raise additional awareness among healthcare providers. And lastly, 6, join community events. And I know we all do this a lot. Host a table at health and community fairs. Use the playbook materials to shine a light on DSMES services. And remember, these are ideas that are from your colleagues in the field. So hopefully you can find one that's relevant to include in your work in the coming future. So let's take a look at a real life case study from our pilot project. So there was a program delivering DSMES services within a healthcare system, and they began to experience a decrease in referrals. So to try to, as a way to remind referring providers of their program, they used the playbook to email providers the outreach letter and copies of the poster and the flyer. And they were updated with their program information. Presented a tailored PowerPoint presentation at a meeting with providers to introduce the playbook and describe their program. Guess what happened? Providers started sharing the materials with their patients. It can be just that simple. And as Betsy mentioned, the playbook was created with the help of many, many partners, national organizations, accredited and recognized programs, people with diabetes, people caring for people with diabetes, healthcare providers, state health departments, and many more. Partnerships will remain important to us as we, together with you, not only spread the word about the playbook, but also to help you and your organization apply the resources to help change the way we all talk about DSMES services. As an example, there are opportunities in place for accredited and recognized programs and state health departments and others to co-brand with us the playbook materials. If you want to learn more about those opportunities and how your organization can partner with us to share with us how you can help or how we can help you, email us at askdsmesplaybook@cdc.gov. And of course, I can't leave my section without having another poll, right? So who's ready for another poll question? Same Menti.com link, same code, same QR scan, and it will be in the chat. So the question is, what is one way you think you can start using the playbook? Share your thoughts. Let's see what people are thinking. Go from ready to share, ready to use everything. Some answers in here. All right. Printing flyers, incorporating the language, the posters, customize and post materials, share with contractors in our state. That's a great idea. Pluck those ready to use messages, send emails to PCP offices and send them flyers. Can't wait to see the Spanish published. That's great. Yeah, we're all waiting on our Spanish to drop. I'm creating a poster for our physician provider offices, marketing, plain language, email blasts. Great idea. Sharing the flyers with primary care providers. Grand rounds. There you go. All kinds of ideas, thinking inside, outside the box, and adding to what you're already doing. Using plain language and posters. Plan to use the playbook to get information to primary and referring providers. Add culturally appealing food choices on flyers and posters. Really great. Know your community. Explaining what what diabetes education is. Posting a link to the playbook on our website. Perfect. All great, great ideas. And I hope a lot of you are taking notes here. You can grab some fresh new ideas for yourself. Using the plain language and flyers again. Send to PCP offices. These are all great ideas. And I encourage everyone to share and adapt and adopt from one another. Thank you so much for your responses. Those are all great ideas for that everyone can use. So to help keep the partnership going and to make sure you have everything that you need to put the playbook into action, we are offering a series of interactive, virtual, hands-on boot camps. This is when you get into the nitty-gritty and really explain the how-to. You can find the information on how to sign up on the screen. We've got the dates, the registration links, and QR codes there. Each session will be limited to 40 people, and that's to help ensure that everyone can actively participate. And to learn more about the boot camps, or if you see a spot and it may be full, just please email us again at askdsmesplaybook@cdc.gov. And we will do our best to get you everything you need, get you in one of these sessions. Well, thank you for your time today. Thank you for sharing your ideas. And now I'm going to turn the mic back over to Alexis to take us into the Q&A portion.
Thank you, Betsy and Keith, for being our presenters today. Lots of great information and lots of questions have come in. So we're now going to begin our Q&A session. As a reminder, you can submit questions in the Q&A box. And so it seems like one of the big questions that's coming up is, what are the opportunities for co-branding? So if we could really quickly talk about recognized and accredited programs and state health departments, what are their opportunities to co-brand the materials?
Yes, this is Keith again. So we've entered into licensing co-branding agreements with our great partners and friends at ADA and ADCES. And if you're an accredited program through one of those organizations, you can work directly with them to gain access to the playbook materials with opportunities to add your program contact information and your logos. And if there are any specific questions on how to do that, we are available here to walk you through that. We've also will place the playbook on the Communication Resource Center site for our state and health department partners. And you can access the playbook materials through that site, through your regular registration. And it will also provide every piece of content that can be co-branded with your local logo, local program information. And we have some how-to and instructive content there as well. And again, send an email to askdsmesplaybook@cdc.gov if you have additional questions, you've got specific needs, and we will work our best to address those.
Thank you, Keith. And along those lines, if you're already accredited or recognized through ADA or ADCS, what are the potential opportunities for co-branding through with those organizations?
if you are already recognized under those organizations, you are ready to go and co-brand. The opportunity is, again, you add the local contact information. You have your logo that can be applied with the ADA or ADCES logo as well. Again, that bringing that additional credibility and exposure through this visible co-partnership, this visible partnership. So if you remember back on the slides where we showed where in the ovals where you could add your program information, there are also spaces on each of those materials where logos can be added. So your local program logo can be added alongside the ADA or ADCES logo, or you can just choose to add your contact information there with the single logo. It's all fit, all according to how it best fits into your marketing needs. So there's no other agreements you have to sign, nothing special you have to, no special protocol other than working with ADA and ADCES to express your need and get those met.
I'm gonna combine a few questions, but in terms of what people can expect next, future enhancements to the playbook, we know the Spanish materials are coming. Are there materials coming in other languages? How can you use these materials with people who have disabilities, who may be, for instance, visually impaired? You can speak to, sort of what can people expect next?
Oh, yes, the materials are available in English and in Spanish. We're looking to see in what other languages this will be translated. And for that, we're having conversations with accredited and recognized programs to learn, to help us guide here in which languages we should be having this in other languages. Question about cost associated in using no, there is no cost associated. I saw another questions in terms of if the flyers and in PDF or Word document. If you go to the website, they are available in PDF, but if you need it in Word document, we're an email away from you all. There is another question, Alexis, regarding the images, where they can find the images. Kathleen, can you explain that a little bit to our attendees?
Yes, of course. Thanks, Betsy. So the images will be eventually available in the CDC Public Health Image Library, but in the meantime, they are available and will be shared or have been shared with ADA and ADCES, and so they'll be posted in the libraries for the accredited and recognized programs. And then we're also sharing them with states and other partners through a couple of different channels. But if you're not sure how to access them or what channel to go through, just please send us an email.
There is another question here about how frequently will the playbook be updated? Well, right now we're kind of launching this, and then we're going to be having that boot camp. But in the middle of that, we have an evaluation plan in place also. So the evaluation plan will inform us the frequency that the playbook will need to be updated. Of course, we're going to be looking to any type of changes in the DSMES national standards, for example. We're constantly working hand by hand with ADA and ADCES in all of this effort. So that will be another way to keep us informed in terms of when updates will be needed. Am I missing something, Alexis, regarding that question?
No, that's correct. Thank you. And then I think the only last point was that the current materials are accessible to people with disabilities that are using screen readers. But we are always listening. And so please feel free to forward suggestions for additional. What you have here is what we have to start off. So if you have ideas for enhancements or additional materials that would be useful, additional languages, please feel free to email us at askdsmesplaybook@cdc.gov.
I would like to add also the fact, Alexis, that we're doing a lead review and environmental scan around challenges for people living with diabetes and disabilities. That work also will inform whatever we're going to be doing with this playbook here. So rest assured that we are taking that into consideration. And one way in doing such is what we have been doing today with the inclusive introductions. There was a question in the chat box that I responded. This is one of the ways that where you can contribute to make webinars more inclusive, especially for people with disabilities.
And did we mention that that this is totally free? This is all these materials are free of charge.
I say it, but it's good to reinforce that there's no cost associated. Yes.
Yeah. They're not available in print, so you can't order the materials at this time. They have to be downloaded from the website.
I can add too, we do, as I think Betsy shared earlier, there are some printing guidelines available though, if you did want to print them, and we can provide support if you're not sure about how to do the postcards or the colors or anything like that. Happy to assist.
There is still one question here for you, Keith, around the materials are free, but you must have permission to use them. For non-accredited, recognized, or state health departments, I think that you will have to reinforce that point one more time. Yeah.
Yes, yes, I know we mentioned co-branding agreements in partnership with ADA, ADCES, but you do not have to be an accredited and recognized program. Anyone who is working in the DSMES services space can use these materials, and it doesn't change your ability to use, reproduce, and incorporate this content into what you're doing.
And then there's another question about whether the materials are geared just for adults, or would they be good to use with young adults or children?
Well, when we were in the development phase for this resource, and we came up with the approach that the DSME services apply to any type of diabetes and to any age-related person living with diabetes. So the messages itself could be very beneficial for school nurses, for example, or for parents that can help those kids. And I do believe that in the library of images, we have kids there, right? Kathleen?
There's families, yes. There's
Yeah.
adults and children in pairs, and then there's different families, yes.
Because one thing that we hear loud and clear, it's make it, number one, easy to use, and number two, easy to be adapted to the populations that we serve. And on top of that, as Kathleen mentioned, we're here to provide the support that you may need. So I'm hoping that answered that question.
Can I just add one? I want to add one more note about the logo and the co-branding. That we do have an unbranded version of the playbook, meaning that there's no CDC logo attached. There's no logo attached at all. There's just a disclaimer: the content was developed from the CDC. We recognize that as much as logos with partners can provide additional credibility, you may have use for some that are actually unbranded, and that's also available. So we try to look at this in as many ways as possible to make it as useful as possible and as usable in different ways for you on the ground in your programs. So you have the ability to use an unbranded version of the playbook, but all the content remains the same. There's just no CDC logo on the actual materials.
And then our final question is, any plans for a national campaign? At this time, our main effort is to get these into the hands of our accredited and recognized programs and our state partners and our partners in the field. Stay tuned. Any future developments will be announced, but do continue to provide that kind of feedback to us, because it's helpful as we plan for the next iterations of the materials that we put out and the support that we provide. So I think that brings us to the end. Any questions that we did not get to live, we will answer and include in the question section with the recording and the transcript. Thank you to everyone who attended today's webinar, and for the great questions and the insights you provided. If you have additional questions, please send them to the email address, and we will follow up with you after our webinar. Here's one last look at the information about claiming continuing education credit, and go on to have a great leap day, rest of your leap day. Thank you, everyone.